Hello everyone, welcome to the third week of medical ward duty or virtual duty here at Maria Reina Xavier University Hospital. And we are actually here at Station 2A and on an AM shift. And of course, welcome back to BSN 3F group number 1. And today is going to be our third week. Since this will be our third week, of course, we'll have a new case, and that's going to be encephalopathy. So that will be our third case for this week, or our case analysis for this week. So I hope that this will be a very productive week also for all of us here in this rotation. But before we proceed to our case scenario, please allow me to have this premise. I am here for you. It's literally my life's work to help you grow. And of course, before that, it is also going to be very important for us to be guided with our learning outcomes for this week. At the completion of this case study, student nurses will be able to build knowledge related to the patient's medical experience. Second is to continue to develop a comprehensive assessment and monitoring skills. The third one is to recommend nursing interventions based on the case presented. The fourth one is to define the roles and the contributions of student nurses in the care of medical patients. And the fifth one is to justify optimal therapy based on the current understanding of the case. So this learning outcomes, again, is going to be our basis for us to evaluate how far we are in our expected outcomes at the end of this case scenario. So I hope that this will actually be achieved by all of us, especially at the end of this case activity. And also, as a reminder of the instructions for this week, since this will be our third week, all critical thinking questions presented within or after the case applies to this case study. You have to create a brief and to the point responses, and of course there has to be no flowery words. When asked to provide several answers, it must be listed in order of priority or level of significance, and then base all your answers on the data that is presented and do not assume information that is not provided in the case. Another thing is, of course, you have to follow the format of your output, especially on its font style, font size, paper margin, paper size, and save it as PDF file and submit all your requirements per group on date specified as its deadline, and then send all your requirements via the official email address of your clinical instructor. And it is advised that you will submit all your requirements on or before the set deadline of submission. So of course, this is just a reminder of the instructions that was actually given since the first day of your duty or the first week of your duty. So let's proceed now to our case for this week. So we'll have case scenario of patient EF with encephalopathy. Please allow me to read the history. Patient EF is a 57-year-old married male, a Protestant by faith, and is residing at Ipunan, Cagayan de Oro City. He has a history of alcohol abuse and was brought to the emergency department of Maria Reina Xavier University Hospital by some of his workmates with altered mental status and reported episodes of seizure. Upon assessment, patient EF has significant ascites or ascites and jaundice to sclera and nail beds. Patient EF was then admitted to the medical ward of the institution or the hospital. He is confused, oriented to person only, and also agitated. Patient EF keeps trying to climb out of the bed and is always yelling coarse language at the nurses and other members of the healthcare team. His ammonia level results are 93 microgram per deciliter. Upon observation, he has also begun to show a fine tremor in his hands and arms. The physician is concerned he may be at risk for alcohol withdrawal, in addition to experiencing hepatic encephalopathy. Patient EF was placed in a bilateral soft twist restraints for his safety. The physician orders the following: Ativan 1 mg IV push PRN every 5 minutes for seizure. Next is Ativan 2 mg IV push PRN every 2 hours for alcohol withdrawal. The physician also orders the following for patient EF: lactulose 20 mg PO every 6 hours and thiamine IV 100 mg BID. Patient EF's level of consciousness continues to diminish, and you as a nurse determined through a bedside swallow study that he is unable to swallow safely at this time. You referred the observation to the nurse on duty and was then referred to the attending physician. Patient EF was then transferred from the medical ward of the hospital to the intensive care unit for intensive monitoring about his condition. You accompanied patient EF and his significant others during the transfer to the ICU. Teachings were reinforced and the words of encouragement were given to the SO. So that is the case for this week. And of course, the patient is diagnosed as having hepatic encephalopathy. Let's now have the high five critical thinking questions. So let's begin with this question. In order to determine, number one, in order to determine the cause of patient EF's alteration of mental status function, what diagnostic testing would you anticipate will be ordered by the physician? Again, in order to determine the cause of patient EF's alteration of mental status function, what diagnostic testing would you anticipate will be ordered by the physician? The second one, in your own point of view, what is physiologically going on with patient EF? Again, number two, in your own point of view, what is physiologically going on with patient EF? Number three, what specific nursing assessments must be done with patient EF? Number three, what specific nursing assessments must be done with patient EF? Let's have number four. From the current situation of patient EF, what safety precautions would be effective to be implemented at this time? Again, from the current situation of patient EF, what safety precautions would be effective to be implemented at this time? The fifth one, or number five, what is the significance of the medication orders made by the physician? Again, number five, what is the significance of the medication orders made by the physician? So again, you have to answer these five critical thinking questions, and of course, this will also be graded accordingly at the end of the week. Just a reminder of your daily duty requirements. Of course, for day 0, Sunday, that will be our case scenario loading. Day 1, Monday, that's going to be February 15, and you're going to submit the following: your GO, SO, DPA, physical assessment, pathophysiology, drug study, nursing care plan. And of course, day 2, Tuesday, that's going to be February 16. You have to submit your SO, GO survey for day 1, sample nurses notes, FDAR of day 1 and day 2, discharge plan, and of course, you have to have your reflective journal reading. And of course, that's going to be our last week, week 3, follow the case study written requirements. And this will be the case study or case scenario written requirements. So that includes your introduction, your nursing health history, physical assessment, anatomy and physiology, pathophysiology, diagnostic test, drug study, problem lists, nursing care plan, discharge plan, learning outcome, and at the same time, of course, you have to have your references that will follow your APA style of reference taking. Of course, the deadline of submission are the following. For your day 1, the deadline is going to be February 15, 2021, Monday, 11:59 p.m. For day 2, February 16, 2021, the deadline is Tuesday, 11:59 p.m. And of course, for week number 3, the deadline is February 20, 2021, Saturday, 11:59 p.m. We are all on our own journey, but in this class, we all need one another and will help one another grow. So these are my contact details. Please don't forget to, or please don't hesitate to contact me via email, via my mobile number, or you can actually do it through my social media accounts. This has been Yucef Bahian Abang at your service to make your best even better. Thank you. To God be all the glory. Bye.